Hey, good morning. Welcome to the Pulse of Healthcare. And we're going to kind of tie some things together. You can see I'm wearing a Space Force shirt today, which is kind of a little inside joke. Um, I know you can tell from my previous podcast that I probably served in the military. I did 22 years in the service. And since I was in the Air Force, you know, when I bought the shirt, a lot of people saying, "Were you in the Space Force?" And I'm thinking, yeah, that only came into existence after I retired. But had it been around when I was in, I probably would have joined it. Because I was a big Star Trek fan and I always thought that would be so cool to be in a Space Force. All right. But today I want to connect the dots a little bit between my military experience and my civilian life experience. And there's some things I say quite often when I'm engaging with different people, and they're saying, well, how do you make that bridge? What's that transition about? What has that meant to you from a business side? And, there's really a core lesson in place. And, Peter and I have discussed this in the past. Good morning, Peter.
Good morning.
And one of the things that I said was one of the hard lessons for me coming from military life to civilian life is in the military, especially in my career field, which was security forces. When you engaged with people, they said what they meant what they said, and they did what they said they were going to do. And, obviously, in a lot of those cases, those were kind of life and death situations. We're making serious decisions. We need to make sure that we can count on our partners, whoever they were, whether they were within our own unit or from units outside of us, that we were needing support or needed our support. We all had to be very forthright in our communication and honest with what we could do, because all of us were making plans based on those comments and decisions, right?
Exactly.
And failure to make those connections and hold up your end of the bargain often meant that there was a gap in security or some logistics weren't taken care of, so troops were in a forward location and they didn't have the equipment that they needed, and just a whole wide range of things. I mean, down to little bitty tiny things that in your brain you think, why is that important? But when you're, deployed to a combat zone, every little thing matters.
Absolutely.
And so I got out in the civilian world and I had this drilled in 22-year mindset that people actually did that. And what I found out in the civilian world was, and it's not true, of course, about everybody. I've met so many amazing people that have done just that, and I can count on them. And I'll go to the bank with them, and they take care of business and they do all that stuff. So I'm obviously not painting everybody I know with the wide brush, but I have run into some groups of people that will say what they think you want to hear.
Yep.
All right. Oftentimes to sell you something or to get you to invest money in something or what have you, but they actually don't have any intent out doing it or delivering on that promise.
It's corporate speak.
And it was hard for me. I mean, I spent 5 years as an entrepreneur and businessman going through that hard lesson. And sometimes I say, I had to get punched in the face multiple times because I'm one of these people that, unfortunately, or maybe it's fortunate, I think it's fortunate that I trust first. I'm not a trust, and then I had to learn trust but verify. Then I had to learn, well, maybe not trust so much, maybe verify first and then trust, and those kind of things. So it's been a real transition for me to go from a very fixed point of space in my mind about how human interactions are done when lives are on the line or when it's really important to not.
Yeah. It's really a transition into what, when somebody depends on it, you're going to get it done. If you just answered it and said, I'm going to do the best I can, then that gives them an open range
Right.
of which they go to the easiest.
Right, or fail altogether, right?
Right.
Well, I tried,
Right.
right? I made an attempt. And obviously, we're all human beings. Everybody makes mistakes. The ball drops, sometimes, and there's just nothing you can do about it. And some things are absolutely beyond your control.
Yep.
But if you know you're up against those kind of things, you should say that, right? Be
Right.
very forthright in those communications. And so now I'm going to bridge that over to kind of the business we're in right now, because this is the pulse of healthcare. So we find this often happens in the healthcare market, right?
Absolutely.
That you have lots of brokers out there representing all kinds of plans, and even these major carriers are putting out things that are not necessarily true. The brokers represent things that are not necessarily accurate. I mean, we just saw a large lawsuit for ghost networks. I've talked a lot about that,
Right.
how this crazy programming that we've got into for the last several decades, where people say, well, I must have a network, or, I'm going to die or something, and it's just not real. It's not true. We know that nobody has ever gone without care. That's been one of our plans, but there's a push-pull on that, right?
Absolutely.
I want to go to the Cadillac dealer, but I want to pay for a Ford. Well, you're not, it doesn't work, right?
Not at all.
Unless you're buying off the used car lot. It's the same in healthcare, right? Some people have this expectation that, well, if I sign up for this big name brand, they're going to do everything that they said, and it's going to be all wonderful and blah, blah, blah. And the reality is that's not the truth, all right? They end up with balanced bills. They end up with, unfortunately, poor customer service, And the response to that is a shrug, generally from their HR, going,
Right.
well, it's one of the major carriers. What do you want?
Well, yeah, it's gotten so complicated with so many different pieces in the process, just to file the claim.
Right.
That there's a lot of areas where people could break down and not be able to, quote unquote, give their commitment, which is the bad service and the miscommunications and all those types of things that happen. It has to take a diligent approach and an organized approach in order to make sure that we can hit our commitments and fulfill exactly what the expectation is.
Yeah, and I agree with that completely. And it's just one of those things that, I just kind of wanted to pop in today and talk about that because, we hear all the time, well, I was told, I was promised, the broker said, and we, and sometimes I hear those things and I go, yeah, but that's not actually accurate.
Actually, one of the problems today, candidly, and I've seen it in my career in the past, particularly when I was wholesaling or teaching to investment advisors and financial advisors and insurance agents about a different product. They can be taught right and interpret it wrong just like a customer can.
Right, and this is one of the things I mentioned just a few weeks ago. When and we have some amazing brokers out there that do great
Absolutely.
work for us, and I sit out there and I listen to them talk and I go, yep, and I nod along and I look out at the group, and people are looking at their phone or staring off into space, and and every once in a while they'll perk up and I'll go, oh, what he just said was meaningful to them, but 60% of the room's checked out. It's just, okay, here's our benefits briefing for the year, and we're going to get it. And they're not paying attention. They don't know what's going on, or they only hear a part of something, or I love it that they filter it through their bias and they hear what they want to hear, not what was actually said, And so sometimes you have to go back and go, no, that's not what was said. And of course, we don't record those, so we can't just play it back and go, no, this is what was actually said.
Yeah.
So it's really an interesting dichotomy of my lessons going, oh, people don't always just tell the truth. I mean, that's not their default station, right? And then people who are used to this, I hate to say civilian world, where they automatically think, oh, you're just lying to me to get me to buy something. I guess. They're already filtering it through this BS meter. Like, okay, so sometimes message sent is not message received. Sometimes
Yeah.
message received was not the message
No
sent.
sense.
I mean, it's completely baffling. And ultimately, it's about building trust, right?
Yep, it's communication which builds trust.
Right. So if I was going to distill down my bridge from military lesson to civilian lesson, I would say three things. First, recognize that everybody you're dealing with, especially in the healthcare world, is a human being. Whether that's the plan, the broker, the front desk at your doctor's office, or even the hospital. Every one of them is a human being. They all have some limits to their capacity
Right.
to understand things. The things they know, they might know well. When you introduce anything that's new or different in an equation, a lot of times they don't know how to react. So they collapse and their immediate response is no, when their
Right.
real response should have been yes. All right. So by a consumer of those products is really trying to innovate in the healthcare space, right? We need to understand that, and then work and collaborate, right?
Right.
So that's kind of the first thing that I've learned. The second thing that I've learned is that, everybody's human, right? The second thing is, of course, message sent is not often message received, and that's because people are not paying attention. And the ones that are the ones that have some kind of immediate medical thing that's going on, so they're probably teed up. But most people are not paying attention. So from the plan side, sometimes you have to take a breath and go, well, we told you that, but what we should be saying is, oh, well, let me help you. We're happy to explain that. Maybe you missed that as part of your orientation.
Right.
Especially if you're somebody that didn't go through the benefit meeting, maybe you're a new hire or something like that. So there's always that, understanding and understanding that people are human beings. Message sent always is a message received, or sometimes a message wasn't received at all, right?
Right.
And then probably the third thing is being empathetic. We have to be empathetic to everybody that's involved in the equation. And that doesn't mean you're always going to say yes, right? One of our slogans here is we don't say no, we say not that way. And the
Right.
reason is because we don't want you to overpay for high quality health care. All right, that means that maybe we say don't go to the palace that's down the road from you because that's going to cost 20 times more and actually might not have a good as outcome as the surgery center or something that's down the road that just in your neighborhood, maybe even the same surgeon in the same cases, all right, that has better outcomes, higher quality, less infection, and guess what? Less price. So same surgeon, same surgery, different location.
Different charges.
Difference could be 20x on pricing. And that makes a difference,
Yes, sir.
I mean, we said this last time, we're seeing healthcare quotes this year coming in at 20 and 30% higher than last year. It's like, how is that even sustainable? I mean, I don't even know what to think about some of that.
Yeah.
And I was able to send out a letter just a couple days ago going, hey, great. Love to let you know that we're continuing your same rates from last year. These are the rates that you've had now for 5 years running, right? I don't think there's other plans out there that can say they've had groups with them for 5+ contiguous years that have never had a rate increase.
It's an amazing fact.
But it has to go back with collaboration, empathy, understanding, and actually working with the plan. And I hate to say the plans get painted in the media and in the public as, oh, they're the bad guys. We're not the bad guys. We're the good, in this case, in our case, I can only speak for us, in our case, we're the guys that are trying to help you get the care you need at a fair and reasonable rate, right?
We found the different ways to do it to cut out a lot of that superfluous expense, or what I'll call greed expense that's built into a lot of the other plans.
I think that's exactly right. So, today in the Pulse of Healthcare, we kind of made a bridge between my military life and my civilian life. I kind of got to reveal a little bit about, some of my learning curve and vulnerabilities, and it's things we do every day, right? I mean, every day when we come to work, we learn a little bit more, we get a little bit better educated, and I think that's so important, especially in this space, because, we don't think about this, like I did in the military, like this is life and death, but, in the healthcare space, sometimes it is life and death, and sometimes the little things do matter. And so it's certainly important that we're doing the right thing, in an expeditious way, and that everybody's in the boat pulling in the same direction.
Well, and we know that people need help.
Yeah.
That's why they're calling.
Absolutely.
And it's a pleasure to be able to serve them and solve their problems.
Absolutely. Anyway, thank you for joining the Pulse of Healthcare. We'll be back again in another week or two for another podcast. Take care.